Gynecology is a branch of medicine that deals with the reproductive system made up of the uterus, vagina, and ovaries. It's important to critically examine gynecological practices because they have historically affected women and other marginalized genders. Gynecology is not simply an objective field of medicine based on cold facts and data. It has an extremely racist, misogynistic, and transphobic history that must be exposed. As we trace the history of gynecology, we begin in ancient Greece, the birthplace of democracy, the Olympics, and hysteria. In the 5th century BC, Hippocrates, who has been deemed the founder of modern medicine, coined the term hysteria. This word comes from the Greek word hystera, which literally means womb or uterus. In ancient Greece, people believed hysteria was caused by violent movements in the womb, so hysteria was deemed a woman's problem. This belief evolved into the roaming uterus or wandering womb theory, in which people, including Plato, genuinely believed that the uterus wandered around the body causing problems. In order to combat this ailment, doctors prescribed marriage, which implied sex, and scent therapy, believing that the uterus would move toward good-smelling scents. Fast forwarding to France in 1880, a renowned neurologist named Jean-Martin Charcot taught his students about the female-only problem of hysteria. Charcot's primary subject was a girl named Louise Augustine Glaise. When she was 13, she was attacked and raped by multiple men and incarcerated at the Salpêtrière Hospital in Paris, where she was diagnosed with hysteria. Charcot's lectures involved hypnotizing Louise and placing her in one of her fits, so she could be photographed and watched by Charcot's medical students. This went on for 5 years until Louise disguised herself as a man and escaped. One of Charcot's students was none other than Sigmund Freud. Freud expanded upon Charcot's ideas about hysteria, classifying it as a woman's illness. He claimed hysteria was caused by repression and penis envy, and that it could be cured through marriage and intercourse. Obviously, marrying someone with a penis or giving birth to someone with one could cure this uterus-only disease. If marriage wasn't an option for a patient, they were prescribed uterine massages, in which doctors would place one hand in the vagina or the anus until a paroxysmal convulsion, also known as an orgasm, was reached. These massages quickly became tiresome for doctors to perform, so vibrators were invented. It's important to note that doctors did not have the patient's sexual pleasure in mind when performing these massages. In fact, many doctors recommended hurting the patients to cause more discomfort during these procedures. And it wasn't until 1980 that hysteria was removed from the Diagnostic and Statistical Manual of Mental Disorders. The clitoris is an incredible human organ that exists solely to bring the body pleasure. Since the clitoris is often associated with women's sexual pleasure, it has been repeatedly misunderstood, pathologized, and erased by ignorant male gynecologists.
You lost her clitoris?
During the 2nd century, Roman doctor Claudius Galen made the bold claim that women's bodies were inverted, failed versions of men's bodies, and that the clitoris was simply the female body's failed attempt at a penis. In 1486, the Malleus Maleficarum, a book about witchcraft used to prosecute people during witch hunts, referred to the clitoris as the devil's treat. This book cites clitoral arousal as evidence of dealings with the devil because the devil was said to suck women's souls out through their clitorises. In the 16th century, 4 different men claimed to have discovered the clitoris, each of them coming up with insulting descriptions for it, including the woman's shameful member and a useless part. During the 1820s, English surgeon Isaac Baker Brown believed that the clitoris was the source of hysteria. He thought that since the clitoris was the source of female madness, it should be physically removed. In 1904, Sigmund Freud pathologized the clitoris by claiming that upon reaching puberty, having clitoral orgasms was a sign of immaturity. Freud also believed that this immaturity was the chief cause of female hysteria. In 1947, Dr. Charles Mayo Gose chose to remove the clitoris from the 25th edition of the Gray's Anatomy textbook of the human body for no apparent reason other than erasing the primary sex organ for people with vaginas. It is only in recent years that scientists, most of whom are women, unsurprisingly, have been given the space to accurately investigate the structure and function of the clitoris. In a groundbreaking study in 1998, urologist Helen O'Connell created a thorough diagram detailing the 18 distinct interacting functional parts of the clitoris's complex and remarkable structure. The history of modern gynecology is rooted in the suffering of Black women. It begins with James Marion Sims, deemed the father of gynecology, who is most well known for the non-consensual experiments he conducted on enslaved Black women. The first patient he experimented on was an 18-year-old girl named Lucy. For 1 hour, Lucy was forced to stay on her elbows and knees in front of 12 doctors as Sims performed an excruciatingly painful surgery that resulted in Lucy developing a serious blood infection. Sims's primary area of study was vesicovaginal fistula, a very difficult complication of childbirth in which a hole develops between the bladder and the vagina and leads to constant, uncontrollable urinary incontinence after childbirth. Wanting to perfect his understanding of this condition, Sims operated on Anarcha, a 17-year-old enslaved Black woman, over 30 times. In the days before modern anesthesia, Sims repeatedly used enslaved Black women for his experiments in order to perfect his techniques, knowing the amount of pain he inflicted upon them. Once his practice was moved to a women's hospital in New York, where most of his patients were white women, he regularly used anesthesia on them. The racist history still affects gynecological practices today, and that Black women are more likely to not have their pain taken seriously. According to the National Partnership for Women and Families, Black women are 3 to 4 times more likely to experience a pregnancy-related death than white women. In 2018, a statue of Sims in Central Park was taken down after much protest, but was relocated to Greenwood Cemetery in Brooklyn, where Sims is buried. Within the 20th century, the emergence of advanced medical solutions rests on the racism and misogyny inflicted upon Henrietta Lacks, a Black tobacco farmer born in Virginia in the 1920s. She was diagnosed with cervical cancer at the age of 30, which she ultimately died from in 1951. While being treated at Johns Hopkins in Baltimore, a doctor took a piece of her tumor without her knowledge or consent. He stored her cells in a lab for further testing, labeling them HeLa cells, short for Henrietta Lacks. No one knows why, but Henrietta's cells never died. Her cells are still alive today. Her immortal cells were crucial to the development of a myriad of medical solutions and are famous within the scientific community. Some examples of their accomplishments are the polio vaccine, cloning, gene mapping, in vitro fertilization, and they have even been sent into space to see how cells react to zero gravity. All of these experiments were conducted without the knowledge or consent of the Lacks family. Henrietta's true name was never made public until the 1970s, and although there have been books and movies created about her, and even lawsuits from the Lacks family, her family has never received financial compensation and still do not own the rights to her immortal cells. To this day, misconceptions surrounding gynecology continue to harm people. In November 2019, rapper T.I. revealed that he goes to yearly gynecology appointments with his 18-year-old daughter, Deja Harris, to check if her hymen is still intact. Even when told the hymen could be affected by sports, horseback riding, or any other rigorous activity, he made it clear that he knew his daughter does none of these things. His daughter took to Twitter to like a few tweets calling him out on how he was being possessive and controlling. On the other hand, T.I. is aware of his son's sexual activity and seems to be fine with it despite his son being younger than Deja. Although many people have reacted to T.I.'s story with disgust and disbelief, virginity testing is actually a procedure that is taken seriously in many countries. The virginity test involves a doctor inserting 2 fingers into someone's vagina to check if their hymen is still intact. In Afghanistan, many women and girls are sentenced to prison for failing the test, and everyday jobs require passing the virginity test. This patriarchal understanding of virginity is actually far from biologically accurate. According to Planned Parenthood, the breaking of a hymen is anatomically impossible because hymens never completely cover the vaginal opening. While we break down misconceptions about gynecology and the hymen, it's important to recognize that gynecology is very rarely inclusive of transgender and non-binary people. In the National Transgender Discrimination Survey, 50% of transgender patients polled that they had to inform their doctors about transgender healthcare. Trans men are often told they're in the wrong place when they visit the gynecologist. This hostility and lack of inclusivity leads to trans people not receiving basic healthcare needs. For example, trans men are far less likely to receive life-saving medical tests like pap smears and mammograms. Another example of a contemporary issue with gynecology is the husband stitch. It's also known by other names like the daddy stitch, the husband's knot, and the vaginal tuck. The husband stitch is an unnecessary extra stitch added during the repair process after vaginal birth.
First, I make a slip. Not too long. Careful as to not rip the edges, making what I call the husband stitch.
Doctors perform this procedure in order to tighten the vagina to increase sexual pleasure for male partners. Most of the time, these procedures are conducted without the knowledge or consent of the person it's being performed on. While this atrocious process supposedly gives more sexual pleasure to male partners, it causes an array of painful side effects for people with vaginas. Reported side effects of the stitch include pain during sex, pain while peeing, being unable to walk for a longer period of time than normal after giving birth, chronic pain and swelling, emotional trauma, infections, and reopening of scar tissue. The husband stitch is an example of birth rape. People often think that rape can only be committed with a body part like a penis. However, according to a reproductive activist, Amity Reed, it can also be committed with fingers, hands, suction cups, forceps, needles, and scissors. Birth rape is when doctors or other medical professionals forcibly use these tools on their own or through medical procedures on people giving birth without their knowledge or consent. The practice of gynecology emerged from a long and complicated history, with intertwining themes of racism, misogyny, and inaccuracy. We expose gynecology's violent history not only to inform people, but also to reveal how science is influenced by systems of power and oppression that hurt marginalized genders. Our next project will highlight the reproductive justice movement as a response to the injustices we uncovered within gynecology.